Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Today we shall be talking about stage 0 breast cancer screening. When we talk about staging in cancers, it's like we are trying to look at the prognosis, that is how long this person will take to correct itself or give finally the parts. But what is not common is that 0 stage of cancer, because at that zero stage of cancer, it is as good as saying bye-bye to cancer if you can nip it in the bud. A stitch in time, the same night. At the 0 stage, cancer will be seriously defeated. So the screening process helps a lot in helping one to detect cancer very early. But now we are talking about 0 stage. How do we know the 0 stage of breast cancer? That is what I want to expose in today's topic, so that when we are very much aware of that 0 stage and we are prone, that is, we are genetically prone to develop cancer, or we have it in the family, then we can quickly put ourselves through the screening test. Although the screening test is recommended for every woman, every girl, everybody that is male. It is not unlimited to female anyway. It has been shown that men too can have breast cancer, and the black race, the black male are usually the larger proportion of cancer incidents among all male races. So you can also understand that the black man is prone, but not very common anyway. But the incidence is highest in black men than in other men put together. But that is not to digress away from the screening, that is early screening. Once you can screen and detect the 0 stage, then what is appropriate will be done, doing the treatment, the necessary treatment that will make the person not convert to stage 1 or stage 2 when this cancer become invasive and starts spreading. But at the 0 stage, you have nipped it in the bud and it's no more. So let's move on to the slide session so that we can have a fuller understanding of what is the 0 stage and how we can help ourselves or help people that are relations or friends or people that generally want to know more about this 0 stage cancer, breast cancer. So if you like what you're listening to, press the like button, subscribe, and let's go on into the slide session for more. The outline: objective, introduction, symptoms, early detection, timely diagnosis, and treatment are all I shall be addressing in this video. The objective: to expose the WHO current advisory on breast cancer, which emphasizes early detection, timely diagnosis, and comprehensive treatment, and how to achieve them all, and what role the medical laboratory scientist plays in all of this. Introduction. Breast cancer is the most common type of cancer globally, according to Global Cancer Observatory, IARC, and World Health Organization 2022. The estimated mortality cases among females was 665,255 in the year 2022. India ranks highest in the number of estimated breast cancer deaths, 98,337 for the year 2022 amongst women. Breast cancer today accounts for 1 in 8 cancer diagnoses and a total of 2.3 million new cases in both sexes combined. According to the American Cancer Society report, 80 to 90% of women have a 20-year survival rate because of its early detection and effective treatment plan with regular follow-up. Yeah, symptoms. We want to believe that once you see the symptom of any cancer, the cancer has already started. The only thing is left is to differentiate whether it's still the benign one that you have or the malignant one. And that's why even stage 0 is called cancer, breast cancer. So breast cancer, like many other cancers, is common from 50 years and above in women who have the history in their family. But early onset at juvenile age, symptoms may include breast lump or a lump in your armpit. That's why breast self-examination is necessary, so that you could discover these lumps. Breast pain, changes in the skin of your breast like redness, dimpling or skin rash, inverted nipples, nipple discharge, with or without nipple pain, swollen lymph nodes, thickening or swelling in your breast skin or nipple. Yes, about half of early onset breast cancer are related to mutation in BRCA1, the breast cancer 1 or breast cancer 2 genes. Once there is that genetic mutation, then you can easily start examining yourself or doing further tests that is recommended to confirm if this thing has already started. The stage 0 of breast cancer has started. If they are not mutated, these tumor suppressor genes will work like a switch to control the growth of abnormal cells that might cause cancer. If they are mutated, the abnormal cells multiply unchecked. If you have a mutation in BRCA1 or 2, you may be at higher risk for breast and ovarian cancer. It is important to note that not all early onset breast cancer is genetic. Some breast cancer occur on their own spontaneously. So this is one of the reason you might want to do the test, the mammogram, very early, at an earlier age than age 50 or above that age. Yeah, this picture would help us understand the daughter carcinoma of the breast more. When you look very well, you will see the nipple being labeled and all the what is called the normal dots is attached to the nipple, and that is usually to serve as the gland that will supply milk to the baby. But this dot could be infected. That's why the stage 0, if you look at the normal dot, there is no cell damage. But to the far right, you see daughter carcinoma in situ. That is stage 0 cancer of the breast. Stage 0 cancer of the breast, where the lump will be so small. The size of the lump will be small, and if detected at that level, it could easily save the situation. Now you can see stage 0, daughter carcinoma in situ. It is that lump up there. Yeah, it is now clearer. You can see that the stage O lump is so tiny, almost not seen. But when you look at the stage 1 lump, it is 2 centimeter length, in size. By the stage 2, it is almost up to 5 centimeter. You can see it so big at the upper edge there. Now we can see the 5 stages of breast cancer, starting from stage 0. Stage 0 has almost very low diameter of that dot. But at stage 1, you can see the lump is invasive. It has started spreading. Stage 2, it's gone to 5 centimeter. Stage 3, greater than 5 centimeter. And stage 4, it has started metastasizing, going all over, spreading all over. And that's when it is almost salvation is almost far from that person. Now to timely diagnosis. We must be clear on this matter that lumps can be more than one It's not necessary that it's only one lump. It could be several, more than one lumps, but once the mammogram is done, it could locate them. But when it is not located, it is necessary for us to know that intervention at this stage will help probably to cure all the lumps that are raising their head. It must be understood that the mammogram can only discover a lump even at stage 0, regardless of how effective it is. It can't confirm if it is malignant, that is cancerous, or just benign, except the histological slide is prepared. It is that histological slide, when prepared and examined, it's a very thin section. When it is now examined, you will now see a cross-section appearance of that cell, the tissue involved, and you will be able to see proliferation of malignant cells and other inflammatory cells indicative of cancer. The genetic test for BRCA1 and BRCA2 looks for mutation in the DNA. So it's a genetic test, and the DNA sequence in the laboratory. Other tests could include MRI and ultrasound. So it is unlimited tests you could do. Yes, finally, is treatment. Of what use is all the diagnosis if you cannot really treat it or make it go? So treatment for stage 0 cancer is typically less aggressive than for more advanced stages. When you have discovered this lump, it's usually to know whether it is whether it's cancer or not. So if it is not, it could be aspirated. That is what is called lumpectomy. That is when you remove that lump. But where it is cancerous and what have you, then you now do the mastectomy, removal of the entire breast. Radiation therapy could also be done after to ensure the thing does not really come up again, and the usual regular follow-up. Hormone therapy is also for cancers that have hormone receptors. Medications may be used to lower future risk. Besides, suggests that up to 40% of untreated ductal cancer in situ, carcinoma in situ cases may eventually develop into invasive breast cancer. So even where the result says it is benign, there is a serious need for continuous follow-up so that it does not change to cancer while you are just leaving it to grow is freely. Well, you have so many videos on this my channel, so you can watch more. If you can also do more research on your own to know more about the stage 0 breast cancer screening test. Cheers. If you like what you're seeing, press like, subscribe, and more video will come from me to you. Thanks.